Dr. Marcy with Agility Physical Therapy and 5280 Restorative Medicine, and we are doing an event today for Colorado women who hike regarding lumbopelvic hip pain. And what does that mean exactly? The lumbar spine, the pelvis, and hips are all connected together, and they can create different types of pain and restriction. And one of the things we want to do for women who hike in Colorado is really improve hip mobility, spine mobility, and stabilize through the SI joint so that you can hike with weight on your back or just in your normal day hikes without increasing your pain. A lot of people ask what exercises are best to do for hip mobility and spine mobility, and so we thought we'd show you guys a couple of those as well, because we'll be giving these to these women who come in for this screening today. The first exercise I typically like to give people is just to kind of improve flexibility throughout the spine in general, and it's a really nice relaxing way to get into your mobility stretches. And that stretch is child's pose from yoga. So you just go down onto the ground, and you can use a yoga mat for this, or if you can't kneel because of a surgery or something like that, you can put a pillow underneath the knees as well. And you just kind of go down into this position, reach out in front of you, and hold that until you feel like it's just a nice comfortable spot for you to be. If you think that it's something where you have tightness on one side or the other, you can bias this. So I'm no longer feeling this stretch in my low back, I'm only feeling it in my left shoulder. So what I would do to kind of isolate the left side is just move my hands over to the right and take a couple of deep breaths into that until that left shoulder and lat loosen up a little bit. And then I'm going to come back to the center and see if that feels better. And it does. I can actually get my elbow on the ground now. So that's the first stretch we tell people to do. And then we also try and encourage them to kind of sit back on their heels and go deeper into that stretch, because it just loosens up where the muscles from the lat attach into the pelvis. The next stretch that we typically give people is a hip flexor stretch. And again, typically we'll give this to someone kneeling. However, if you have that problem with you've had surgery on the knee or you can't kneel on the knee because it's too sensitive, use a pillow. You can also do this when standing with your foot on a chair, and I can show that modification as well. But what we have people do is put one leg forward, use a stick for balance, and then reach over the top of your head and grab that stick while pushing both hips towards the front. And you're gonna hold this for about 30 seconds. And just kind of breathe into that. Now you'll notice if you put the arm down, the stretch won't be as intense, and that's because the muscle we're stretching actually attaches from the femur all the way up to under the diaphragm, and that's why having this arm over your head does help open up that area as well. It stretches all the way up to the diaphragm. If you want to twist a little bit, that'll stretch it slightly differently as well, but just be careful if you've had a back injury that's recent. We don't want you doing any twisting. The last stretch that we typically give people to work on mobility is specific to the hip capsule, and I'm going to just move this to the other side because I promised myself I would start demonstrating this with my left, not just my right. So what we have people do is come down onto all fours, slide one leg out to the side, and then walk their body towards that foot. We then have them start rotating the foot up and down, and I'll have them do that about 5 or 6 times. And then try and sit with their bum back onto the ground. And you'll feel that stretch through this whole adductor area and into the groin. You're gonna hold that for 3 or 4 seconds and then bring the pelvis forward like you're going into a modified cobra for yoga. Hold that for a few seconds and then come back again. And you just do that until it feels like the hip is loosened up a little bit and the adductor has loosened up a little bit. And of course you would do both sides. If you feel like you have a limitation in your hips, in your SI joint, in your low back, or you feel like you're one of those people who, I've gone to a chiropractor, I've gone to a physical therapist, and it seems to get better for a little while, but it's just not continuing to stay better. It could be a restriction from the hip capsule, and we can help you address that by doing some mobilizations. I promised I'd show the stretch with the chair. So here it is. This is my chair. Any chair will really work, but same stretch. I have my leg on the chair. I'm thinking about standing nice and tall, pushing this hip forward, and I'm just reaching up and over my head and bending slightly to the side. If you have any more questions about hip, back, or SI joint pain, please let us know and comment below about the video if you like these stretches. Have a great day.